Tell me one memorable moment that you will always remember at MedicAlert.
Oh, Peter, this one is an easy one, and it goes back to what we were talking about before about the phone calls that we get in our 24/7 from our 24/7 hotline. And I remember you playing me this call.
Mhm.
It struck you. It was very emotional for you, and when I heard it, it was very emotional for me. And I'm getting goosebumps right
Ah,
now again, because it was real and it was raw. And it goes back to our dementia program. There was a woman living with dementia who was relatively early stage, and the day before or 2 days before, she'd been riding the subway with no problem. She'd been chatting with her daughter, and then she went missing.
welcome to the MedicAlert Matters podcast. I'm your host, Peter Lawrence. In this first episode, I sit down with MedicAlert's president and CEO, Leslie McGill. We discuss MedicAlert's mission, the importance of MedicAlert services, and how MedicAlert continues to innovate in the field of health and safety. During the podcast, you'll hear a heartwarming story of how MedicAlert helped one of our subscribers. To stay connected with the podcast, subscribe to the channel Medical Alert Matters podcast on Spotify, Apple Podcasts, and if you'd like to watch, catch us on YouTube. Enjoy.
MedicAlert Emergency, how may I help you?
I'm a paramedic with BC Ambulance Service. We've run into a patient who has one of the bracelets.
And she's walking, but she's not feeling particularly well, and she showed me her bracelet. So I think we might need a little bit of help.
Did you find her?
Yes, we did.
Oh my God! Oh my God! Thank you, thank you, thank you.
Leslie McGill, welcome to the Medical Alert Matters podcast. How are you doing this morning?
Oh, Peter, I'm doing great. Thank you so much. It's so fun to be here.
I know it's the first episode. It's amazing. I'm so excited. So, right off the bat, then, Leslie, can you share some information about yourself? Tell me about yourself and your role at Medical Alert.
So happy to do that. I have the honor of leading the best team ever at MedicAlert. I'm the CEO here, and I've been here for about 5 years. And what a whirlwind that these 5 years have been, Peter. You
Oh,
know
I know.
exactly what I'm talking about. It's been pretty incredible. But there's a lot that's going on in our environment, and I'm so excited to be here today to talk to you about all of the changes and maybe help people to understand a little bit more about MedicAlert versus what they might know actually about MedicAlert, what they think they might know about MedicAlert.
This is you hit the nail on the head. So there are misconceptions about MedicAlert. I've heard it many times over my years here. So you hear some people say, "Oh, you're the bracelet people." Or
Mhm.
sometimes if they're sort of familiar, they might say you're for allergies or diabetes. Can you clear up everything today and let people know about our service and what we provide?
Sure. I may not be able to clear up everything, Peter,
I
but
know.
I'll do my best in
Yeah.
terms of being able to respond. But you're right. Oftentimes people think of us as the bracelet organization, which is really what we were for a really long time before the advent of technologies and mass communications and all of those sorts of things. I mean, we were born in the 1960s, and I became a subscriber not long after that. I should not say that out loud too much, but nevertheless, I think the key thing that people probably don't know about us is that we actually run one of the largest healthcare databases in the country. And that is really important because it allows us to do many different kinds of things, particularly programmatically. So what people know about us best is the bracelets, and perhaps they know about a subscription, and perhaps they know about the information exchange we have with first responders, which has really grown over the course of the last 20 years, I would say in particular. But one of the things that they might not necessarily know about are our programs. We have a dementia program, which is really taking off. And we have a kids program, which is evolving. We have a support program called IDEA, which is the Inclusion, Diversity, and Equity in Action program, which is really helping individuals from all walks of life who may not necessarily have the opportunity to get a medical alert, not just because of financial reasons, but it could be because they have a language barrier, or they might not necessarily be comfortable with the Canadian healthcare system because they're newcomers to the country and don't necessarily understand what feels comfortable to share versus maybe what they chose to share or not share in their country of origin. So those are all the sort of the major programs. We have an Indigenous program as well called Carry Back Home, which helps individuals living with fetal alcohol syndrome disorder. So there's lots on the go in our environment, and it's really a very exciting time to be part of MedicAlert.
It is. It is. And you mentioned you're a subscriber. And as you know, in the audience, if you're listening now, I do a lot of community engagement and I'm there at events. So I'm meeting a lot of MedicAlert subscribers right now. And then I hear the number of years they've been subscribed with us. And they share personal stories on how MedicAlert helped them in situations. But overall, I've heard a lot of hotline stories where MedicAlert, and especially the ID, wearing the ID, assisted police in finding missing individuals or providing paramedics with crucial medical information at that time of need. As a subscriber yourself, can you share a personal story where MedicAlert made a significant difference in your life?
Oh, 100%, Peter. So a little bit of context for you. I'm one of those subscribers who's been a subscriber for a really long time, more than 40 years.
Wow.
So I won't have you guess actually how old I am on that front. But I became a subscriber, or my mother insisted I become a subscriber when I was quite young. I had encephalitis, which is swelling of the brain. It was a complication of measles. And out of that, what happened for me was that I ended up having a seizure disorder. And so as a little kid, I had lots and lots and lots of seizures. I also had lots and lots and lots of allergies, which is something you mentioned before. A lot of people know and understand MedicAlert for allergies, which was a very significant thing in our history. But fast forward for me, I was 28 years old with a brand new baby. She was 6 weeks old.
Wow.
And I hadn't had a seizure in more than a decade. And I thought, okay, I've finally outgrown all of this. So off I went to the mall for my very first outing. It was the middle of February. It was really cold. And I thought I needed to get out of the house with a brand new baby and go and stretch my wings or my legs or whatever you may want to call it. I literally was in the shopping mall when I had a massive seizure. And I literally collapsed into a concrete bench and cut my head wide open on that bench. And it was actually a Good Samaritan who recognized my ID and made the call to our 24/7 hotline, which connected all of the dots, because there are lots of dots to connect together in this process. But part of my condition and those allergies I was speaking to have an impact effectively when I'm working or an emergency responder is working with me. So there's things they should not do in my particular case. And so those emergency responders were ready when they got to the scene, because my situation could have been significantly worse than it ended up being. So I have been a user of the service. I understand it completely, and I'm right there with you. I'm sometimes out with you in the community, chatting with our subscribers. I listen to the calls to the 24/7 hotline, and they give me goosebumps because I understand firsthand what it means to be protected by the MedicAlert service. So I'm grateful for it. And I am a strong proponent, not just because I'm the CEO, but because I know it works.
Yeah. Yes. Thanks for sharing that story. Your story is very personal, and I've heard the story before, so it's nice hearing it again. And I'm glad you're sharing it with our audience. And even on that, I hear stories from paramedics personally when I'm at events and police. What feedback have you received from paramedics or police, or even just the first responder community?
So I get a chance to actually talk quite a bit to first responders in my role, and there's lots of different things that they share with me. Part of it is the fact that they value the information that we have and that we share with them. But what's happening with the country's 911 system right now is really important because it's actually changing the way that paramedics work, or police work, or fire work, because 911 is their central dispatch process, and there's a lot of investment in making changes to the country's 911 system right now. So one of the things that we're starting to hear a little bit more from first responders is they're ready for us from a technological perspective. They want the information, but the pressures that they have, particularly coming through COVID, that was probably a big wake-up call for many people on many fronts in the world of first response, particularly paramedics. And the other thing that's having a really significant impact for many services across Canada is the fentanyl crisis. And so the kinds of responses that they're going to are health calls, much more than, especially for police, if I were to give that as an example. Police calls 30 years ago are not the kinds of calls that they're getting today. 60% of policing calls are fundamentally health-related calls, mostly mental health-related calls. So they want help with de-escalation. They want information before they get to the scene. They have technology now in their hands that wasn't available to them even 5, 6, 7 years ago. So they're saying, come on, MedicAlert, we're ready for you. And we've just come through a major digital transformation. So I think we're ready for them too.
Yes. Okay. So you just touched on my next question. If you could share a little bit more information too on how MedicAlert's adapting to the changes in technology, because the way we share and receive information, especially medical information, always changing, and I've seen it over the years. So is there anything else you want to add to that on how we're adapting to that and the healthcare needs?
Yeah, absolutely, Peter. So one of the ways that information exchange works is the old-fashioned way. And we still do that. We still pick up the phone. There's all of those phone calls that happen because sometimes that actually is the best and the fastest way to be able to give and receive information. And we've had a what we've called the portal or the hotline viewer since about 2015 now, so almost a decade. And that adaptation that we did a decade ago allowed dispatchers to actually have a look into an individual's medical record. And what many people may or may not know or realize is that there's a special number on the back of the ID. It's a unique identifier. So nobody else has that number. I have mine, you have yours. And nearly 1 million other people have their own. And that's actually what allows us to be able to share information directly when it's needed in an emergency response. Nobody accesses that information unless it's an emergency response. We're very, very, very particular about privacy and security, which is a big piece of what we've been doing over the course of the last decade for sure, as privacy legislation changes. But that's the boring part. The exciting part is actually the real technology that we're introducing. So last year, we launched our brand new technology stack. We called that our digital transformation, or internally we called that Project Circe, because it was a little bit of alchemy, if you know anything about the Greek goddess of alchemy, because sometimes technology is a little bit of, push and pull and mix things together in order to be able to get it to work properly. So we're really proud of that, because what we've done is we've updated our system. And that update of our system is allowing us to do so many really exciting things. And I wanted to maybe share a little bit about a project that we're doing in Ottawa that is going to make a difference. So if I can share that, Peter,
yes, go ahead.
I'd be happy to. So we have a project going on in Ottawa with the Ottawa 911 Communications Center. We call it HELP 911, and the HELP is an acronym that stands for Health Exchange Linking Police. And that's literally what we are doing. And I'll spare you the technical details, but essentially their system and our system talk to each other without a human being being involved. And that allows us to be able to get information much more quickly to dispatch, to get that into the hands of a first responder before they even leave the station. And if they can have that information before they leave the station, they will be prepared when they get to the scene. And that takes minutes, because when they arrive on a scene, especially in a health crisis, they have to do an instantaneous diagnosis. They have a protocol that they run through. but part of that protocol can be short-circuited with having information ahead of time. We can't tell them what the specific situation they're responding to is. That's dispatch's responsibility. But we can give them all of the supporting information, particularly if it's related to a de-escalation or it's something like a diabetic going into a diabetic coma. And so they don't have to do a sugar test before they arrive. It's highly likely, based on what they can look at observationally, that they don't have to be invasive in their essentially their immediate attending protocols. So and there's another really interesting piece of information that I'd like to share with you about this. And I happen to be with a bunch of 911 dispatchers, maybe 3 or 4 weeks ago, having a conversation about this project. And it blew my mind when I first learned about the data from our project, and it blew their mind completely. So when I arrived at MedicAlert, one of the things that I actually said was, well, how often do people actually call 911? Like that interaction with 911, I think I've maybe called 911 in my entire lifetime 3 or 4 times. And I think my mother probably called, well, 911 didn't exist when I was a little girl, but over the years I've called for my kids, all of those sorts of things. But it's not often. It's not a weekly occurrence or a daily occurrence, or so I thought. So one of the things that we do is track all of the calls that we receive where our data is utilized. So in the city of Ottawa in 2022, we had 170 calls of some sort accessing people's information. I thought, okay, that's not too bad. That's a call every 3 days accessing information. That seems to be maybe pretty normal because we have about 50,000 subscribers in the city of Ottawa. Then when I took a look at the data from the Help 911 project, I was astonished by what I learned, because over the course of the first 8 months of this year, because this project's been in market for about 8 months, 9 months now, what we saw was that, in fact, when our systems are talking to each other, there were 8,141 different records accessed in our system in 8 months. So that to me says the power of technology is the power of being able to help somebody when they need it the most. So to go from 170 phone calls where we had human intervention to technological intervention, that means we had a fairly significant impact on the individuals who are MedicAlert subscribers in the city of Ottawa. So this pilot project finishes at the end of this year, and then we're going to go talk to the CRTC, which is the regulator of the 911 system, and say, see, we told you. We knew intuitively that it worked, but technology is actually giving us the visibility around this. And that is monumental when we're talking about the number of calls that are rising on health calls coming into 911 centers. And it makes a huge, huge difference in people's lives.
Yes. And when you said you're going to CRTC, it's good when you have that data too. We have so much data in our system that's useful for so many things. And I was just finding that out probably in the last 2 years. And we use that for different things. So very important.
100%, 100%.
Yeah. So one of the last questions I have for you is 2024. It's 2024. We've launched many programs at MedicAlert. Are there any programs or initiatives that you're excited about that you can share with us today?
100%. I've used that quite a lot. So there's a lot of 100% things that are happening inside our organization. But and I'm excited about all of our programs because we've spent an awful lot of time in the course of the last 3 years reinvigorating some existing programs that we had. We have just relaunched our children's program, calling it MedicAlert Kids, and we've been introducing the Super Squad, which are cartoon characters that really help young children to understand what they can do to self-advocate in their classrooms or on the playing field or wherever they may happen to be, where people might not necessarily feel so comfortable about including them in exercises or activities because they're worried that they're going to be hurt. And that's not necessarily always the case. So that's one thing I'm really excited about. But if I go back to that technology thing, which is really sort of where, and the data piece that we were talking about before, Peter, where we've really taken off is in our dementia program. And that program is called Safe and Found. And that's what MedicAlert does in the dementia space. There are other wonderful organizations who help with education. There are other amazing hospitals and research facilities finding a cure. And we fully support all of the work that they do. But for us, we're in a very unique, specific place, because in 2012, what a lot of people don't know is we actually took over Canada's National Wandering Registry from the RCMP. And it sounds like maybe a bit of an unusual place for a wandering registry to be with the RCMP. But the RCMP at the time was navigating and managing essentially centrally ground search and rescue in this country. And they were sort of the experts in that field, but what they weren't the experts in was medical data and medical information. And they found it very difficult to manage that registry. So they came to us and said, will you take this particular registry over? And we did. And so at the time, we took on 30,000 individuals into this registry. And we've grown that registry to more than 60,000 people over time. And that's where that data becomes particularly important, because we have academic partners that study that data with us to be able to look for patterns around wandering behavior. And most recently, we've uncovered a few really interesting pieces, and two of those things I want to share with you today.
Of course.
The first is that when MedicAlert is involved in what's called a critical wandering instance, when somebody has gone missing, in 91% of cases, people are returned home unharmed. And when we say unharmed, there is no medical issue with the experience that they had while they were missing. When we're not involved, that percentage decreases to less than 50%. So that data that we house in our wandering registry is key. And when we share that with first responders and search and rescue crews, it makes a huge, huge difference in the outcome for people. So that's a big, important part of data and technology. And where we're the other thing that we discovered with our partners at the University of Waterloo was something fascinating. It's the first in the world. And that is that we can identify a date range of the mean time. Now I'm getting super scientific, but it really is about, we can predict when somebody is likely to wander. That's the easiest way of describing it. I'm overstating that right now because there's a lot of work to be done to be able to develop things. So what we're doing with this research and this information is we're turning it into products that will help people and care partners for people living with dementia. So we are at the early stage of something called Early Alert, where that's the first step in our new product to be able to help caregivers understand when their loved one will wander. We can assess risk right now, and with more data and a group of people who are willing to test all of this with us, people who have dementia or our care partners agreeing to work with us, we can go further to be able to develop what we're envisioning in terms of an early alerting system so that people can live a much greater quality of life. Because what happens with people living with dementia, Peter, is that oftentimes their loved ones get scared. And that's completely understandable because it's such an unpredictable set of diseases. And one day you can be having a conversation, next day the person could go missing. And you have no indication that will happen. So the stress that creates means that oftentimes people will be in a locked memory facility. They don't have a lot of mobility. But what there's also research to support is that the more social interactions that people have, the more ability that individuals living with dementia have the opportunity to live what we would say would be a more normal life, like literally going for a walk around the block. And so we want to be able to help and support that so that the quality of life for an individual living with dementia is increased and their length of life is increased. so that they spend more time with their family and their loved ones. And so that's where technology is playing a role for the work that we do. It looks really different than what we looked like in 1961 when we
Yeah.
started with engravings on the back of an ID. But at the end of the day, that idea that started with Dr. Collins and his wife Chrissy is really the impetus for the kinds of information that we like to share that improve people's lives. And that's what's so important. And that's what technology is doing for us now.
Yeah, thanks for sharing. I'm very passionate about our Safe and Found program because, as you know, when I'm out in the community, I'm talking to care partners, family members who it's either the beginning stages or they're sometimes close to the end stages of dementia. So I hear all the in-betweens too. So when I got wind of this program, like Early Alert, when we were discussing it last year, I was excited. So I'm just waiting to hear the next steps in that.
We're getting super close. We're getting super
Yes.
close, Peter. And that's one of the things that's really helpful for us. When we're a charity, and one of the ways that helps us advance projects like this is people who are willing to make donations to help
Hmm.
and support our continued research and our product and program development. That's what changes things and allows us to be able to move things more quickly. We don't have any government funding, so we rely on the generosity of others to be able to help and push these things forward. We've got lots of ideas waiting in the hopper. It's just really about being able to get the community support, the corporate support, whoever is looking to be able to have that level of impact. And it can be $100 at a time. It can be $100,000 at a time. It doesn't really matter. It's really about being able to support a population, particularly with respect to dementia, that is growing. I mean, our dementia population will double in this country in the next 6 years.
Yeah.
And that means wandering, which is a slice of the dementia space that we work in, is going to become an epidemic. There are 27,000 wandering instances in Canada every year. It's 27,000 families who are looking for loved ones.
It's
And
scary.
that'll be by 2030, that'll be 50,000 families looking for missing loved ones. That's hundreds of people per day who are missing. And that's distressing. And so whatever we can do to be able to help and support that, we're all in 100%. We need help to be able to make that happen.
Yeah. And you know what's it's crazy when I talk to people at these events. It used to be like even with any general conversation, it used to be like everyone knows someone who knows someone with cancer, a family member, a friend. You just ask it in a classroom, put up your hand, and you see the whole classroom put up their hand or something like that, an audience. Now I'm finding it's dementia. So when people approach the table, if I ask them, do you know someone close or even a family member, a neighbor, they say yes. So it's
100%.
it's crazy just to hear the number now, and we know it's rising.
Yeah,
Yeah.
and so we're playing our part in being able to help that community and those care partners and those people living with those complex set of diseases. It's an awful thing, and
Mhm.
there is no cure on the horizon. I
Yeah.
know lots of people working in the research space trying to get there, and I admire them immensely. But in the meantime, we need to help and support what's happening now. And I
Mhm.
think that's the role that MedicAlert plays.
Mhm.
And we're very proud to play that role in helping people living with dementia and their care partners to make sure. And one of the other things, if I can put in a plug for our incredible medical team, that's
Mhm.
another thing that people don't necessarily know about
Oh yeah.
MedicAlert, Peter, is that we actually have 8 internationally trained physicians on staff in our organization. They're the people who manage that record. They're the people who do the intakes with our subscribers or caregivers or care partners. They're the ones who go through all of those thorough list of questions. They know and they understand. And that's one of the key differences when it comes to MedicAlert is that team and our database. And you and I are both familiar. We've walked into, let's say, drugstores, or we've looked online on Amazon, and we hear it a lot from individuals out in the community. You see this all the time.
Mhm.
People will say, "Well, I have MedicAlert," and then they'll show you their bracelet,
Yeah. Yep.
and then you will
Mhm.
say, "That's not MedicAlert. That's
Mhm.
something that you bought in the drugstore and grocery store." And people will say, "Well, it's the same, isn't it?" And hopefully, our conversation today has helped people to understand that it's not the same. There is no direct connection to police services and dispatch with those other IDs. In fact, we train thousands of first responders every year in terms of our protocols and how we help them and how they access their information. There is none of that goes on with other IDs. And in fact, the first responders won't even look at those other IDs because they have no idea whether that information is accurate or current. That's what our medical team does. So there's a big difference when it comes to the work that we do. We can't stress that enough. And this podcast is one of the ways that we can share that information about who we are, what we do, and who we do it for, and the care that we give to managing people's health information, and because it matters in a crisis situation for sure.
Yes. Well, thank you for sharing all this information. This has been great. But I got one more question for you, and it's
Okay.
actually a choice. So,
Oh, okay.
yes. Do you want
Okay.
me to read out my left hand or my right hand? Which card?
Well, I like to say, Peter, that I'm definitely right-brained, which is creative and intuitive. So let's go with your right hand.
Right. Tell me one memorable moment that you will always remember at MedicAlert.
Oh, Peter, this one is an easy one, and it goes back to what we were talking about before about the phone calls that we get in our 24/7 from our 24/7 hotline. And I remember you playing me this call. It struck you. It was very emotional for you, and when I heard it, it was very emotional for me. And I'm getting goosebumps right now again. Because it was real and it was raw, and it goes back to our dementia program. There was a woman living with dementia who was relatively early stage, and the day before or 2 days before, she'd been riding the subway with no problem. She'd been chatting with her daughter, and then she went missing, and her daughter was beside herself. And so what ended up happening was the woman was found by a Good Samaritan, and 50% of the time it's a Good Samaritan that gets involved. It's not necessarily always first responders. And so the Good Samaritan called. He had found this woman's mother on a bridge 10 kilometers away from home. And she'd been missing for more than 24 hours. And so we have a 24/7 service, and so the Good Samaritan knew to call the number on the back of this woman's ID. He called, and the operator thanked him, gave him some instructions, and made sure the woman was okay. And then she said, "Would you like me to connect with her daughter?" And this is the part that gives goosebumps because you can hear it in the call. And the daughter picks up the phone, and our operator says, "We found your mom." And then literally she bursts into tears. She's crying. That's the moment that we know that MedicAlert saves lives. Those are the kinds of things. And oftentimes we don't see it. It's a little bit of an invisible thing that lives behind the scenes in many cases. But at the end of the day, when you can hear it and you can see the impact, I've lived it personally. We know several other people who have. That one call says it all. And it's still, as I said, I'm tingling right now because we do save lives and we make a difference for people. We reconnect families. We give people hope. And those are the things that are fundamentally important. That's one of the most poignant moments in my 5 years here. And that's something I don't think I will ever forget.
I have to tell you, I've probably listened to that call probably 40 times because I shared it with some of our police partners, some of our colleagues. And it's probably around, the last couple months where I could listen to the call and not have the watery eyes because I kind of trained myself because I was breaking down the first 10 times I heard it, the first 20 times, but it's so impactful, just the reaction. And
I would agree, Peter. When people are in crisis and their loved ones want to do everything they possibly can and they feel helpless because they can't, this is where we step in. We've always talked about MedicAlert being someone's voice when you need us the most. And it's so true. There's so much that happens in an emergency situation. And until you actually live that kind of situation, you don't really appreciate it until you're actually in the mix. And if we can deliver that level of relief to a loved one and we can keep people safe while we're doing it, then we know we're doing our job, and we're going to do that for at least the next 60, 65 years.
Amazing. This has been great. This has been great. Thank you for sitting down with me. Is there any final words you'd like to share with our audience about the importance of MedicAlert?
So one of the things that we've just completed, Peter, is our next strategic plan. And we have a vision as part of that strategic plan. And that is a MedicAlert on every wrist in Canada. And that could be a literal interpretation, or with technology, it could be a metaphorical interpretation. Because at some point, sometime, people will experience some medical crisis. It's not just for people with allergies. It's not just for people with chronic health conditions. You can have a medical emergency and be a perfectly healthy person. And first responders want to know if they can treat you freely. If they don't have any restrictions, it's just as important as if you do have restrictions in terms of what they can do to care for you while they're getting you prepared to go to the hospital. So that's one of the things that's our vision as an organization, for people to truly understand, because there are so many gaps in our system around information sharing. And it's not automatic that first responders have access to people's information. The perception is that that's the case, but it's actually not the case at all. So that's one of the things I want people to really take away, is that we are in the business of bridging those gaps, and we're here to help. That's really our sole purpose, is to help you to be able to manage in an emergency situation. And I can't say enough about that. I've been a subscriber, as I said, for more than 40 years, and I will continue to subscribe to the service that saved my life.
Perfect. Amazing. Thank you for sharing. So that's a wrap. Thank you for tuning in to this episode of the MedicAlert Matters podcast. Subscribe, share, like, and stay connected on our social media to never miss an episode. Until then, stay informed and stay safe.